Hello, mga adlaw sa tanan. Ako si Ryan Macasero, ang multimedia reporter sa Rappler sa Cebu. And joining us today is Dr. Mary Jean Loreche, the Chief Pathologist and Spokesperson for the Department of Health, Central Visayas. Daghan kay salamat para sa pagdawat sa among imbitasyon karong adlaw, doktora, o diretso na ta sa mga pangutana. Okay, so I think let's start with how is Cebu City doing now? In the beginning of the year, we had a 3-month spike of cases. Now we're starting to see it level off. And now we're seeing the capital see a big spike in cases in COVID-19. So can you take us back to how this spike started and why it lasted, for so long and where we are now?
There are two things kasi, Ryan, we have to understand. There was that first wave, and that was sometime in May, June of last year.
Of 2020.
In 2020. And then you are comparing that with our, again, surge of cases sometime mid of January until towards the middle of February and third week of February, right?
Mhm.
So if you look at it, let me just talk about our cases. Let's not discuss NCR first.
Okay.
So here in Central Visayas, during the first wave, and that was early, mid of 2020,
Mhm.
we noticed that at the time, we weren't really prepared for it. Primarily because, again, we were not able to, although we had isolation facilities, we had temporary treatment monitoring facilities, but at the time, parang fragmented din tayo dito. We
Yeah.
were not able to do things synchronized, coordinated, collaborative ang ating efforts. But eventually, we learned from that. That's
Okay.
why from an epicenter, we were able to open up as an MGCQ in September. And until now, even despite the fact that we had that second surge in January. So yun yung magkakaiba.
Okay.
For this time around, we were already prepared because number one, we had enough testing, molecular laboratories to do the testing. Number two, we had adequate TTMFs and isolation facilities. Number three, our private hospitals has already maintained their 30% bed allocation. No? Pang-apat, makikita natin, napakaganda ng contact tracing ng Emergency Operations Center. So,
Okay.
na-isolate kaagad nila, nako-contact trace, natitest natin. So, these are two different issues. So, titingnan mo, critical care utilization now, it's very, very low. We have never breached that 60% and above para masabi mo na critical ka, no? O kaya naman nasa warning zone ikaw.
Okay. Just for the benefit of our audience, can you tell us where we are in terms of critical care utilization? Because I think like you mentioned, that's one of the big differences with 2020 and now is that we saw our hospitals hitting above the danger zone then, except right now we were able to manage it. So how are we able to make sure that our hospitals did not get filled up and the critical care beds?
Napakaganda ng tanong mo, Ryan. No? So critical care utilization as of yesterday's data is only 28.1%. So sabi nga natin, 60% and below, no, para masabing safe zone tayo. Pero 28.1%, that's amazing. Meaning to say, we have very much available beds should God forbids na magkakaroon tayo ng uptick of cases. So pangalawa, bakit kaya naging ganito tayo at nahawakan natin ng ganito? Una, sa lahat nga, we have also trained our people. No? There is so much awareness now of people na alam nilang pagka may masamang pakiramdam nila, magpapakonsulta na sila. Last year, ayaw nagtatago, natatakot. So ngayon, there is people awareness now. Pangalawa, we have encouraged our hospitals as well as our patients, pagka-asymptomatic at saka mild, huwag kang magpapa-admit. Bigay natin yung kama na para sa'yo doon sa mas nangangailangan, which are the moderate to severe to critically ill individuals. Nung araw, alala ko last year, no, Nandyan tayo palagi sa Facebook. Tinitingnan nila nakapila yung mga ambulance sa labas ng driveway ng emergency rooms. At saka meron pa nga tayo na yata nag-viral na namatay siya doon sa labas lang. Because there were no hospital beds, emergency rooms cannot accommodate them. But then we learned from that, and again, sa pagtutulungan ng ating private at government, ay nakayanan naman natin ito.
And correct me if I'm wrong, so before we even had the spike, we have isolation centers for asymptomatic and mild, correct? Can you talk a little bit about how you categorize where to isolate positive cases?
That's correct, Ryan. No? Meron tayong mga temporary treatment monitoring facilities, meron tayong isolation facilities. Ngayon, we went one step further despite the fact na marami na tayong ganyan kasi ang private sector nag-step in no? Kaya nagkaroon tayo ng NOAA, ng IC3 natin, yung ang Sacred Heart dati. So meron tayong mga ganyan aside sa DPWH.
Right.
We went one step further, understanding the need for our patients na who can afford to pay, who doesn't really want to go to a temporary treatment monitoring facility. So we had to talk to our hotel industries here. So the advocacy, so we worked well with HRAC, and then the advocacy is yung mga hotels na malalaki na maganda yung kanilang location at willing naman sila, pwede silang pumili maging quarantine facility or isolation hotels. So, papa-credit natin sa ating DOH at saka sa DOT natin, and we train their people also how to handle these cases. So those who can afford, instead of staying in their homes, nagtatago kasi ayaw nga nila talaga sa TTMFs natin, so we put them there. They pay for it. There are medical personnel that makes rounds. So parang nasa hospital pa rin naman sila, may magtitingin pa rin sa kanila.
So that's one of the big ways that you were able to keep hospital admissions down, was providing alternative centers for those who are not necessarily critical, no?
That's correct, Ryan. Isa yan sa ating mga ginawang moves dito that really has helped us with our fight against COVID.
Can I ask, so just to articulate for our LGUs, what are can you name like the three most important best practices of our LGUs here in Cebu that helped us manage our cases and kept the hospital admissions down?
One of them, kay tatlo man yung hiningi mo sa akin, gusto ko sana 10 eh. So, isa lang muna. So, ang isa is actually, sa totoo lang, it's our Emergency Operations Center.
Okay.
This is really the heart of where we are in our fight against the pandemic. A very good, structured, efficient, and competent Emergency Operations Center, which is under the LGU. So, yan pa lang, alam na natin na magiging successful yung fight natin against the pandemic. So that's one best practice. The second best practice natin ay napakaganda nung samahan natin with our LGUs. As a matter of fact, alam naman ninyo yan, no? Na we give guidance to our leaders, and they have respected us to the point that they do listen and give weight to our recommendations. Pangatlo, siguro dahil we've been together so much already here in Central Visayas, na natuto tayo na yung ating mga LGUs, particularly yung ating mga leaders, are very cooperative and there is so much collaboration. Sabi nga natin, no man is an island. Tayo dito ay archipelago nga tayo. So we are intertwined, no? What affects Cebu City can also affect Mandaue, Lapu-Lapu, and the province. So there is that very good working relationship and respect.
And I have to ask this. Here in the Central Visayas, our economy is very reliant on tourism as a big industry. And the several provinces like Cebu Province, Bohol, and Siquijor want to open up to tourists. But considering that what's in the news every day is this increase in cases nationwide, is it really the best time to push for something like reopening tourism? In the opinion of health experts?
Yeah. this is the best time to open already. There is no other time. If we're gonna wait for a year or two more, kasi hihintayin natin bumaba yung kaso natin before we start learning to live with COVID, then patay na tayong lahat niyan, no? So there is a way of balancing economy and yet being able to protect our people in terms of healthcare, no? So yun na nga, kailangan meron tayong processes and protocols in place. Operational excellence ito, Ryan. It's not something na every time you have a surge of cases, you lock down a place. O kaya naman every time may bagong variant of concern na dumating, magla-lockdown tayo, strict border control. Hindi ganun yun. We learn to live with COVID, meaning to say, we put in place yung para bang papadiran mo na pag may pumasok sa'yo, alam mo kung anong gagawin mo. So, pwede naman silang pumasok and pwede naman natin ibukas na talaga yung ating tourism natin, provided there are measures that we have to put in place. And one of the best measures that we can do is actually to have the testing protocol in place. Secondly, a very good syndromic biosurveillance, meaning to say, alam natin na heto siya, ganito, so dapat hahabulin natin yan, i-contact trace natin pag nangyari na nandyan siya sa atin. And by strengthening our healthcare capacities, by making people adhere to the minimum public health standards, wala namang imposible, Ryan. We can safely open it.
Even doctoral provinces like Bohol and Siquijor, which don't have necessarily the capacity that Cebu does in terms of medical facilities, should that be a concern for tourists considering going to those provinces, or have they prepared for it?
Eventually, these places also will learn to be able to put in place the necessary protocols. And they can actually observe what we're doing and follow suit. They can take out the best practices that we have, adopt it, and tweak it according to their needs.
Okay. Sige, I wanted to move on because the big story the other day was this supposed Central Visayas variant, which the leaders of Cebu, including yourself, objected to. And can you talk a little bit about why people should not call it Central Visayas variant? And I know this was a mutation that was discovered in February, right? And now it's referred to as a variant first discovered in the Philippines. So how did we get to that point? Why did it become, some people started calling it Central Visayas variant, and how should we address it?
Siguro matutuwa pa tayo kung tinawag natin siyang Ryan Rappler variant, di ba? Ano kaya pakiramdam mo noon kung papangalanan natin Ryan Rappler variant? Di ba? Parang, teka lang, nakakatakot naman siguro. Anyways, so alam natin na part ng ating pagiging proactive in trying to solve our problems on the surge of cases, kasi we observed a certain pattern. Napansin natin kasi na maakyat yung kaso natin na tapos naman yung holiday. So hindi na siya post-holiday surge. Tapos naman na yung lahat ng mga activities related to Christmas, to New Year, to our festival here. So wala naman. So bakit and yet tumataas pa rin ang kaso natin? Pangalawa, mapapansin din natin na may mga bata na din na infected, no? Pangatlo, napansin din natin na parang dati ang isang bahay, 10 kayo, iisa lang ang nagpo-positive. Pero nitong huli, parang 5, 10, buong pamilya affected na sila. So we started thinking about doing a biosurveillance. So we wrote a letter to Central Office requesting that we be allowed to submit samples for biosurveillance. It started there. So sometime in mid of January, we started collecting samples na pwede nating ipadala doon. So we sent the first batch and then the second batch. Then true enough, nung kalagitnaan ng February, bumalik nga sa atin na meron nga tayong mutations of concern. Gusto pa nga nilang tawagin ito mutations with potential clinical significance. So okay lang tayo kung yun ang gusto nilang tawag. Tuloy-tuloy tayo ng papadala ng samples kasi gusto nga nating malaman. No? And then, during our previous meetings, they called it P.3 variant. Meaning to say, para siyang nakaakibat, nakasandal kay P.1, which is the Brazilian variant. No? So, tayo naman, okay lang, P.3, no? Kaya nga, medyo magulo kasi yung number na binigay nila sa atin, hindi naman nagtutugma. Kaya nagsabi pa ako sa inyo dati nung tinanong ninyo ako anong status. Sabi ko, no, I cannot divulge the numbers. I'll stay it at 67 kasi yun lang ang tinatanggap ko. Hindi ko tatanggapin yung ibang numbers kasi wala silang binigay na line list. Hindi nila tayo binigyan ng information kung sino ito at saan doon sa samples natin. So nagulat tayo na bigla, out of the blue, magkakaroon ng posting na nirelease nila na Central Visayas variant. Tapos 105 pa talaga ha. Hindi biro yun na 67 lang naman yung sinabi nila sa atin. Ngayon magiging 105. Bakit naman ganon? Hindi naman nila tayo in-inform sa DOH. Hindi naman nila binigay yung listahan ng ating mga samples kung sino ito sila, di ba? Except dun sa 67 na meron na tayo. So, ang pagkakaalam ko, nung pinadala nila yung resulta ng kanilang pagsusuri dyan sa Philippine Genomic Center, sa GSAID, no? Dun sa Global Initiative for Data Surveillance for Influenza-like Illnesses, no? Kasi tinatapon yan doon para mabigyan ng pangalan yan eh. Nagulat tayo na sabi P.3. Bakit? What? Why? What happened? Why would they zero in and call it a Central Visayas variant? So ako tutol talaga ako doon kasi that is discriminatory in nature. Pangalawa, kung titingnan mo yung mga variants na meron na ngayon sa buong mundo, pangalan ng kanilang country, di ba? Hindi naman sinulat doon na London variant. Hindi naman sinulat doon na North Cape variant. Ang sabi, South African variant, UK, United Kingdom variant, Brazilian variant. So what changed? Bakit tayo, ibang bansa tayo sa loob ng Pilipinas? Kaya tatawagin nilang Central Visayas variant? Di nga ba't mas magaling kung tatawagin nating P.3? Stick tayo doon. Huwag nating baguhin yon.
So have you received any response from the central government on your complaint about the name, or you're still waiting to have that conversation with them?
I think we will formally submit a letter of clarification on the matter. Okay. Hindi naman siya protest, no? But clarificatory in nature. So medyo na busy lang tayo ngayon dahil sa dami ng mga nangyayari ngayon, no? Ang dami nating mga, kumbaga may maraming sunog na kailangan kong sundan para patayin, no? So siguro tomorrow is a holiday. Hopefully, I would be able to already draft that and discuss it with our team, including with RD, on the next moves that we will be doing. But definitely, we will be writing a letter requesting for clarification on the matter. And secondly, we are protesting really that it should not be named a Central Visayas variant. Ganito kasi yan, Ryan. Hindi siya po pwede Central Visayas. Alam mo kung bakit? Kasi yung mga mutations of concern sa laman ng P.3 na tinatawag nila Central Visayas variant, heto, nakikita din ito doon, ang iba nito doon sa UK variant, sa Brazilian, at saka sa South African variant. So ngayon, since tayo lang ang masipag ng ngolekta ng samples, gusto nating malaman, tayo lang ang merong ganon. But how would we know na hindi din yan galing sa ibang region? Na hindi din yan dumaan ng NCR, tapos nag-travel pumunta sa atin, di ba? So, these are issues and concerns Pero for all intents and purposes naman, dalawa kasi ang pwedeng reaction nito Dahil discriminatory siya, it can be detrimental to us also in a way because number one, matatakot yung tao pag narinig na galing kang Central Visayas. Ikaw, siguro Ryan, hindi ka na nila papapasukin. Sabihin nila na, ay, baka si Ryan may dala-dala yung CVV, di ba? Kaya naman, ikaw nag-apply ka abroad. Ngayon, nandun sa listahan nila si Central Visayas variant dahil mataas yung ating kaso natin. Hindi ka papapasukin. You know, you would feel bad, di ba? Ginawa na natin yan Finlag natin yung mga countries na meron ng mga variants of concern Ngayon, kasali na ang Pilipinas sa binan ni UK at saka ni Ireland. Hindi na nila tayo papapasukin muna dahil mataas yung kaso natin sa NCR+. So ang point ko is, this is, a nation, one country. We are just part of that country. So bakit tayo ngayon? Tayo lang yung sasalo nung mga problema ng mga variants of concern na yan.
Mm-hmm. Just to reiterate for our audience, you're saying that just because it was found in the Central Visayas first, it does not necessarily mean that it was created or it became a variant here, because we have a more proactive biosurveillance compared to many other places in the country. Is that correct? Am I understanding that correct?
Let me put it this way, Ryan. Dahil tayo nga nag-collect ng samples doon sa ating mga targeted population, kasi we have always been targeted in our approach, no? Strategic kasi yung ating testing dito. At napansin nga yan, nakita nga yan doon sa genomic sequencing niya na may pagbabago sa kopya ng iyong virus sa kaniyang RNA, no? So, ibig sabihin lang naman doon na dahil hindi natin na-control yung mga kaso natin sa mga panahon na yon, ibig sabihin ay dumami yung cases natin. Kasi malamang itong mga viruses na to, pagka mas marami siyang nahahawa, nagkakaroon ng mutations of concern.
Okay.
So kung mas marami ikaw napupuntahan, ako, kunyari, Ryan, no? Meron akong coronavirus ngayon, pinasa ko sa'yo, pinasa mo sa mga 10 mo pang kasamahan. Pagdating sa iyo at sa mga kasamahan mo, hanggat sa dulo ng kaniyang nahawaan, posibleng nagbago yung anyo ng iyong SARS-CoV-2. Ganito yung nangyari sa atin. Dahil madami yung ating mga kaso, so nagkaroon ng oportunidad yung SARS-CoV-2 na magkaroon ng mga mutations niya, pagbabago. Opo.
Okay. I know I've asked you this so many times in our weekly press briefings and in our Viber chat, but I will just ask you again for the benefit of our audience. What are the characteristics of this P3?
Ang characteristics na nitong mga mutations of concern natin, particularly yung E484K and 501Y, P681H, no? Ang problema sa kanila is this, and this has been found also in the other variants, no, that has been diagnosed or detected prior to our P.3. Increase in transmissibility, meaning to say, mas madami siyang mahahawaan. Kung dati nga isa lang, ang pwedeng hawaan ay isa lang, ngayon ay pwede siyang makahawa ng 10 o kaya ng 20. So yan yung una na problema sa kanya. Pangalawa, pwede kasi na mas magiging matapang si SARS-CoV-2. Mas highly virulent. The word there is virulence, meaning to say, mas nakakatakot siya kasi pag siya ay dumapo sa'yo, baka posible na mas grabe yung iyong sakit kaysa yung sa original na SARS-CoV-2. Pangatlo, dahil ongoing yung ating pagbabakuna, meron tayong tinatawag na immune escape, meaning to say, there is a possibility na yung bakuna na ginagamit natin ngayon ay hindi na kasing epektibo kaysa kung ang original na SARS-CoV-2 ang ating hinaharap. So, doon tayo natatakot kasi hindi pa tayo tapos magbakuna. Kakapiranggot pa lang yung nabakunahan natin. So, kailangan hindi talaga ito lumaganap para maging effective yung ating mga vaccines.
And so jumping off the vaccines, I just wanted to get, you're involved in the vaccine operations here in Central Visayas. So could you share with us, so we're starting with our A2 and 3 priority groups, no, after the health workers. So what's our outlook? Are we following the schedule in our over 5 million targeted vaccinations this year? Could you give us a brief update on that?
Our goal is to be able to vaccinate our 5 million more or less eligible population for Region 7. But then, as we say, kailangan natin yung bakuna. So, ang magpapaantala lang sa ating achievement for our goal would be the availability of supplies, which means the vaccines. So, ang ating A2 at saka ang A3 is senior citizens, ang ating namang A3 are the persons with comorbidities. Nagsisimula na tayo sa ating master listing sa kanila. so that we would be able to be prepared already should the supplies arrive. So there are two things here that we are doing. We're preparing our vaccination sites, both.
So yeah, the vaccination sites you were saying are being set up as we speak, no?
Yeah, so that's correct, Ryan. As I was saying, two-pronged ang ating approach, where we approach it two-pronged. One is the preparation of the LGU vaccination centers. That's for the community level. At the same time, we have the private sector, the Project Balik Buhay, preparing also for the private side, for especially for the corporate accounts. So yan. So yung dalawang yan, pinaghahanda na natin. The reason for that is this. Once we are ready with our vaccination centers and the supplies come, we can always do the mass vaccination. So we will be able to achieve what we have intended to achieve. Vaccinate as many as we can, as fast as we can, before these variants of concern will be coming over or will take over with whatever coronavirus type we have right now.
And I think one big problem we're having, not just us, but the entire country, is vaccine hesitancy. Cebu City, I think, only had 11 or 12% registration for senior citizens. So as members of the community here in Cebu, how can we encourage our elder loved ones, grandparents, and those with comorbidities to register and get vaccinated, to kind of remove that hesitancy, no?
Okay.
Sige. So as we're saying, senior citizens in Cebu City, we only had low registration to begin with. Hopefully it's increasing, but as residents of Cebu, how can we encourage our grandparents to not be so hesitant to take the vaccines which are going to be available to them very soon?
Our call actually, Ryan, to our people here in Central Visayas, lalong-lalo na yung mga senior citizens at saka yung persons with comorbidities, kasi age 3 na yun na huwag silang matakot, magpa-master list sila, magpalista na sila. Kasi naman ang bakuna kailangan natin. Pangalawa ay, ang bakuna kasi, ang trabaho ng bakuna na binibigay natin for COVID-19 is really to prevent only you developing a severe disease. So, kunyari, nagkasakit ka ng COVID, lalo na kung may edad ka na o kaya may comorbidity ka, at least hindi ka mapunta sa intensive care unit. So, may posibilidad na mas magaan yung magiging sakit mo. Pangalawa, it prevents clinical disease kasi. So, kunyari nagka-COVID ikaw, hindi naman ikaw makakapasok pa ng ospital kasi parang wala ka lang naramdaman or very mild lang ang iyong symptoms. So, kami ay nananawagan talaga, magpabakuna tayo, huwag tayong matakot. Dalawa ang ating ginagamit ngayon laban sa pandemya. Ang ating minimum public health standards, tapos isabay na natin yung ating bakuna. Kung iisa lang ang ating panghahawakan, yung ating level of protection may not be as good as kung silang dalawa pagsabayin natin.
Okay, and just to wrap it up, what's your message for Cebuanos and all of us here in the region to continue fighting COVID, and what can we do to make sure that we don't have another surge? What's your message for us?
Very simple, Ryan. Learn to live with COVID. Because in learning to live with COVID, alam mo naman na nandyan na yung virus Ano ang pwede mong gawin para i-protect yung sarili mo? Diba? Magiging maingat ka. Kung mahal mo ang sarili mo, mahal mo yung pamilya mo, at yung bayan, kailangan i-protect mo yung self mo. And how can we do that? By disciplining ourselves, making that minimum public health standards as part of who we are already. And by doing that, I think we will be able to live the new normal without shutting down our economy and yet enjoying what we used to enjoy with some limitations only.
Okay, thank you so much. We've been talking to Dr. Mary Jean Loreche, Chief Pathologist and the spokesperson for the Department of Health Central Visayas. I'm Ryan Macasero, and you've been watching Rappler Talk.